I was really interested in PRP because I know it's incorporating your natural body's healing properties. So by the platelets that we get from the plasma, they release growth factors, and that encourages a natural sort of stimulation of collagen and replenishing and reinvigorating the skin without any harmful effects. So a lot of people who've never had aesthetic treatments before are obviously concerned about the effects of looking unnatural or overfilled. So PRP is a great starting place for those people because there's nothing you can do that's going to harm them. Whilst it does involve a bit of needling and can be a bit traumatic and people can be a little bit bruised afterwards, it's still a great place to start for a natural, rejuvenated, refreshed approach. Now, the thing we have to remember when we're counselling patients about PRP is that it can take time to see the effects. So you don't get an immediate response. You've got to be patient and expect that it'll take up to 2 to 3 months to feel that the skin is reinvigorated. And it can be quite a sudden thing that they suddenly notice about the 6 to 8 week mark. They just feel better and fresher, and people stop telling them they look tired all the time. It's excellent for the under eye area because a lot of people start to get a bit tired and dark looking under their eyes in their sort of mid-30s onwards. So people who are starting to complain about being told they look tired all the time or having dark circles or having sort of saggy eyelid skin, it can be excellent to help that area and make them look fresher. We can also use it a lot for acne scarring in the face. So a lot of our patients have had acne scarring from their teenage years. They find that the combination of PRP with microneedling will really improve the scarring without sort of much in the way of sort of long-term side effects or problems. Usually it takes up to 2 to 3 treatments, spaced 2 to 3 months apart, to get them to the point where they see the improvement in the scarring. But the results are quite astounding, and no expensive lasers needed to do it. PRP we also use in the neck and décolletage area because it's an area that doesn't often match up with your face. People have had work on their face where they might find that their neck's starting to look really a bit like a turkey. Their décolletage is often sun damaged and creased, and it can really help tighten and freshen that skin and match their cosmetic units with their face and their neck up much better so that they can stop the clot moving forward. We also use in the back of the hands. So a lot of people age quite significantly in the hands, and we only notice it when we put our hands up to our face. Suddenly you can see how old the person is. So it's fantastic for that sort of solar damage, sun, dry, moist. People are having to moisturise their hands all the time. Notice that the PRP makes a big difference. So there's nowhere you can't use it. So it's a fantastic thing to offer in your clinic. In terms of a family care physician or a primary care GP or skin cancer doctor, very minimal uptake in terms of equipment and low use of costly consumables. So the actual cost of what it takes to set up in your clinic is very affordable. I see it as one of the go-to first things you should be doing in your practice before you go out and buy expensive equipment that are going to have high consumable costs associated with them. So it can be done. You can come to one of our lectures on the weekend, you can learn all about it and approach one of the companies who have the PRP equipment and be set up in your clinic the next week and go for it straight away. It's that easy to incorporate into your clinic with low cost.